Hello and welcome to Ask the Doctor. I'm your host, Mike Berger, here to answer your questions on pain management and alternative pain management. Today is Dr. Robert Bulger from the Southwest Pain Group. Southwest mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on the screen. It's 1-888-572-4411. Or go to the website, www.southwestpaingroup.com. We're going to start today's show off with a look at a common complaint, or what I think has become a more common complaint, fibromyalgia.
Yes.
So I guess people have found out more about it, including the medical community?
Yes, and it's a very interesting and yet very challenging diagnosis. First of all, it's controversial. There are actually physicians today that still think fibromyalgia does not exist, but is simply an element or an overlay of depression. But in fact, over 12 million people have the diagnosis. It's about a 10-to-1 ratio of women to men. And it's a frustrating condition because there is actually no specific one treatment for it.
Are there certain things you look for, Dr. Bulger, when you're trying to diagnose this disease?
Well, yes, because first of all, the symptom complex is rather diffuse. It's achy joints, kind of chronic fatigue, pain all over, depression, insomnia, difficulty concentrating, literally irritable bowel. I mean, it's such a symptom complex that it often masquerades. And so you have to go through a process to figure out, make sure it's not something important.
So it's not something that you can take a quick test.
But
well, I understand, but it's not something you can take a quick test for and, oh, that's what it is, fibromyalgia.
No, in fact, it's a very frustrating condition, and that's one of the reasons it's now more in the news. People are finally accepting the fact, okay, people have this, what are we going to do? Mm-hmm. You look for things like thyroid, you make sure it's not a heart condition, vitamin deficiency, lupus, rheumatoid diseases, you go through a whole list. Lyme disease, for example, mm-hmm. could create the same symptom complex, mononucleosis. So once you go through all those things and make sure they haven't got that, then you finally arrive at it's probably fibromyalgia.
Are there specific treatments or a battery of treatments you can use to help people with that?
There actually is no one treatment because there's not a cure for it. So what you do is you focus on the symptoms. And usually the main symptoms are depression, insomnia, and a lot of pain.
Okay. Now on the phone lines, and we want to remind our viewers, if you have any questions about fibromyalgia, or for that matter, any other painful medical condition, you can call the number on the screen. It's 1-888-572-4411, or go to the southwestpaingroup.com. Now we have our first phone call from Martha in Grand Prairie. Martha, go ahead with your question.
I'd like to know if you could do anything about the pain of fibromyalgia from the joints and pain side. Thank you so much. Have a good day.
Well, yes, actually, there are things you can do, and again, we just spoke about it. Everything from conservative to aggressive. A lot of times, you have to figure out where the pain is. Many times, the pain is in particular areas called tender points, and fibromyalgia patients have more of these. Everyone's heard of like a trigger point or a little muscular sore spot, but fibro patients, and we call them fibro, is kind of the slang in the medical lingo, they have more of them in more places. So we'd focus on that with her. She may also have joint pain, and I might consult a rheumatologist and have a rheumatologist help me with that. So drugs that treat arthritis, medications to treat muscle pain, and actually there are a lot of homeopathic and natural therapies, including hormone therapies, that seem to help.
So it's not necessarily just a joint pain or a muscle pain. It can be a combination of both.
Well, interestingly, with fibro, the presentation is variable. So, for example, maybe you have a lot of chronic abdominal pain and occasional aches and pains, and your wife says, stop complaining, go work in the yard, you know, like this morning. But the reality is you might have that, although it's more common in women. But the confusing and challenging things because the symptom complexes are so variable.
Interesting disease, and I'm sure that people are doing a lot of research on it, trying to narrow this down and even make a better diagnosis for it in the future.
Well, we're kind of accepting it. And remember, I told you it's a controversial diagnosis. Mm-hmm. Some physicians didn't accept it for a while, and now they are, so I think we're seeing more about it.
Very good. When we come back, we're going to take more of your phone calls, and we'll look into the use of ultrasound in pain management therapy. Stay with us. And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today is Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411. Or you can visit the website at www.southwestpaingroup.com. Now, one of the tools used in pain management is the ultrasound machine. And Dr. Bulger, ultrasound goes back to beginnings in World War II and sonar.
That's right, Mike. It's actually a version of sonar. Now, a lot of people know about ultrasound because you have one when you have a baby and you're interested in the progress of your infant. But if you look at the slide, you'll see that it was first developed in World War II to help the Allies detect enemy submarines. But today we're using it to help locate pain. And one of the cool things about ultrasound, which is exciting for us in pain management, is the fact that ultrasound allows us to locate a painful area and inject a joint much more easily. For example, in the olden days, we could use an X-ray machine or we could feel around. With ultrasound, if you look at the monitor there, I can locate her joint. And I can locate the shoulder joint and the bursa. And if you look at the first picture on our slide for the audience, you'll notice something interesting. With the ultrasound, you can actually see all the tissues. You can see the muscles, the tendons, the ligaments. And if you look at the next slide, where the regular X-ray, our audience is probably noticing this X-ray, you don't see that. You can't see any of the important tissues to inject the shoulder. So in this case, if I want to inject her shoulder, all we have to do, and I want to emphasize for the audience that obviously we use sterile conditions, syringe, needle. We're not doing that today, of course. but normally we would inject these things, and the ultrasound allows us to locate things. If you look at the
now, what are we looking for? Are you looking for maybe a tear in a muscle, Dr. Bulger?
Well, now, if you look at the next monitor image on our monitor, what you're going to notice is something interesting. That if you look at the if you look at that needle right there, you can see the red arrow shows the actual needle. I can actually guide the needle into the joint, and I can put the medicine in the right spot.
Exactly where it needs to be.
And that's the key thing, Mike, is that with ultrasound, we're actually able to put medication in the exact location, and which we're not always able to do before. If you look at the next image for the audience, what you're going to see something very interesting. With the ultrasound, you can see that green arrow shows exactly where the medicine is supposed to go. And another important thing about ultrasound is it makes sure we don't put it in the wrong spot. So for example, if you look at the next image overhead for our audience, what you're going to notice is that those yellow arrows show where the bone is. We don't want to hit the bone. We don't want to cause infection. So one of the cool things about ultrasound for the audience is to know that ultrasound allows your pain management specialist or physician, whoever's using it, to put the medication in the right spot. I'd like to show the knee joint now too. In a similar way, if you take a look at this, our monitor and our live image, we can actually see the knee joint. And it's actually very, very easy to see the patella, the knee. You can actually diagnose things. You can also place the medication in the right spot. Now, so if you go ahead and take a look at our image overhead for the audience, what you're going to notice on the next image is that the little red arrow there shows the audience where the biceps tendon is, and that's important. When we inject tendons, we don't want to actually go in the tendon. We actually want to just put the medication around the tendon. So that's one of the great advantages of this, is that it allows us to put medication in the right location. And that's one of the most powerful things about it.
So with sonar, just to kind of recap, we can see exactly where the problem is.
Right.
We can put the medication exactly where it needs to be, the right medication, so the healing process is going to be a lot quicker.
Well, there's a lot of advantages. First of all, there's no X-ray. In my office, I can roll this machine from room to room, and I can quickly find out where the problem is. I can put the cortisone medication in a knee joint, a shoulder joint, a trigger point, and actually you can do diagnosis with ultrasound as well. You can locate painful tissues. You can locate edematous tissues, joints, and yes, we can do these things with X-ray, and yes, we can do them kind of just by examining the joint like we were trained to do, but in reality, the ultrasound machine gives your pain doctor a way to really find the painful area quickly, and with a lot less muss and fuss. By the way, less cost. X-ray machines cost a lot more than ultrasound.
Sounds like a deal. Now, if you have any questions regarding ultrasound, or if you'd like to make an appointment, just go to southwestpaingroup.com, and we'll be right back with some questions. And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain management today is Dr. Robert Bolger. Just call the number that you see on the screen. It's 1-888-572-4411, or visit the website at www.southwestpaingroup.com. Now, Dr. Bolger, we've talked about ultrasound. We've had the demonstration. Can you tell us if there's something else ultrasound can be used for besides maybe joints, or is there something fascinating you found about it that works for you?
Yes. Well, the thing about ultrasound that's so interesting is that it's used not only for treatment, to direct treatment, but it can be used for diagnosis. And radiologists, of course, have used ultrasound for years for that. As an example, I recently went to a meeting, ultrasound meeting, and I've had some trouble with my wrist, carpal tunnel type symptoms. And the director of the program was a radiologist, and he showed me how to use ultrasound to diagnose carpal tunnel syndrome. And as it turns out, I think I probably have it. So it was very useful. Another really very useful thing with ultrasound is piriformis injury or sports injuries. A lot of people get pulls and muscle strains, and you can actually see these muscular injuries with the ultrasound device. So it's a really burgeoning area for pain doctors, because in the past we've had to rely on MRIs, which are expensive, and of course physical exams, very important, can't be underlooked, and patient complaints, but using ultrasound as an adjunct in the pain doctor's office, in essence, moving this out of the radiology suite and into our offices is an exciting thing for us.
Well, I would imagine, especially with athletes, the quicker you can get to them if they've had an injury, the quicker you can diagnose, the better off they're going to be, and the easier it's going to be for you to treat them.
As a matter of fact, more and more professional sports teams are now have ultrasound machines in their facilities to help more quickly diagnose, tears, sprains.
So the doctors are right there. They
Absolutely.
Can hook it up and they're ready to go.
Yeah.
We have a question now from Ellen in Arlington. Ellen, go ahead.
I have a question about rheumatoid arthritis and fibromyalgia. Is there anything natural or homeopathic that you can use to treat that instead of regular pain medication? My name is Ellen, Fort Worth.
Thanks, Ellen.
Well, Ellen, that's a great question, and it's an area of particular interest of mine because we talked about fibromyalgia before, and we understand it's kind of a symptom complex. Many people think that it may be related to rheumatoid disease. So the fact that she asked about rheumatoid arthritis is very appropriate. Rheumatologists focus on this, and we do too, and because in a lot of ways what rheumatologists and pain doctors do is very similar. My particular interest in fibromyalgia is trying to focus on treating the symptom of the muscular pain. Now, we don't know what causes it. We've already mentioned that.
Sure.
But we can try to improve muscle function. So I put a lot of my patients on a special program that involves calcium and magnesium. For example, magnesium, for Ellen, is a very, very useful thing. Many women don't get enough magnesium in their diets. If they're menstruating, they lose magnesium. The vitamins, magnesium, there's a number of antioxidants. Our old friend fish oil is very, very useful.
I know you're very high on fish oil.
I'll tell you, the rheumatologists tell us, and we found in our practice, that fish oil really does reduce the inflammation. There's a lot of chronic aches and inflammation related to both rheumatoid arthritis and fibro. So, and finally, Ellen, I have a lot of interest in hormonal therapy. More and more doctors are using testosterone, progesterone, growth hormone, which is in the news with Roger Clemens and things like that. We understand that hormone has some benefits. It also is a very healing hormone, and there are actually clinics and physicians that are using growth hormone to treat fibromyalgia. I have not yet done that, but I have a lot of interest in it, and I do believe there's the customization of the therapy to meet the symptoms is very exciting to me.
Sounds pretty fascinating. We've
very,
covered a lot of fibromyalgia today.
It's a very interesting topic. It's challenging, but there's a lot of people working on it.
We have one more question from the website. Chrissy in Arlington says that she has arthritis pain and inflammation from the knee up to the thigh. Is there anything she can do about that?
Well, the first thing we got to make sure is, Chrissy, what's your diagnosis? Because we want to make sure, is it acute injury? Is it something chronic? I'm not sure that, from the question, I can't tell that.
Yeah.
But you need to make sure it's not an injury, or there's something that's surgically correctable. Maybe it's something's torn, but if it's a chronic arthritis condition, then again, going from our conservative friends, which would be things like fish oil, anti-inflammatories, all the way to powerful arthritis altering medications, you know, there's a wide spectrum. The answer is yes, we can help you in a lot of ways. I would use an ultrasound machine to help look at her knee.
I was going to say it'd be a perfect time to use an ultrasound.
It would be a perfect time to.
Sure.
Absolutely.
We're going to be right back from the Southwestern Pain Management after this break, so stay with us. A lot more ahead. And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain today, Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411, or visit the website at www.southwestpaingroup.com. Doctors, without going into too much detail, or in this case, doctor, because Dr. Rodriguez is with us today, can you share with us one of your most interesting or one of your most challenging cases?
Well, you know, during the break, I mentioned this case to you, and I think the audience, your listeners, would like to hear about this.
I think they'd be fascinated by this.
This is a challenging case. I had a patient who was actually an obstetrician. She's a practicing physician at my hospital campus. She was about 30 weeks pregnant, and she had a bad bronchitis. She actually coughed so hard, she fractured a rib.
And that's not that unusual.
No, it's unusual, and everyone knows a rib fracture is a painful thing.
Sure.
I mean, it can sideline a football player. So, but here's my dilemma. She has to practice. She's still practicing. The baby was kicking her in the rib.
The broken rib.
And she has to work and take care of patients, so she couldn't take painkillers. How am I going to relieve her pain? Now, I ended up doing some nerve block therapies on her, which can help, but I was a little bit of trepidation here because I didn't want to puncture her lung.
Sure.
The baby's right there, the lung is there. The ultrasound machine would have been a great thing for me then. Now, I didn't have it back then, this a couple of years ago, but the ultrasound would have showed me the lung, the rib, and all the anatomy, and I would have, it would have been a very comforting thing to have.
Sure. And of course, X-ray is not available to you in this case.
Well, you don't want to use X-ray and
Sure.
somebody's pregnant, so that was a particularly challenging case.
So that can now be solved with the help of ultrasound.
Well, I still have to do the block, and
sure. But you know exactly where
I know where to go, and I think I'll feel more comfortable from now on.
All right. I think we have another question, a website question. Maria from Grapevine would like to know, and she says, I'm in recovery for addiction to painkillers, so how do I treat my pain without becoming addicted again? That's a great question.
It is an important question because if somebody's in recovery, it means that they've already gone through the process of weaning themselves off their pain medications, or they're taking a medication like Suboxone. They're probably under the care of an addiction specialist. That we can help these patients. We work with addiction specialists all the time, and there are ways to help her pain, control her pain without having to resort to narcotic medications. Sometimes there's a lot of little things you can do to help with the pain.
Is helping a patient like that with something that's not addictive, is that a little more difficult because of a prior addiction? Has it affected their body, changed their what do I want to say?
The physiology?
Physiology, any at all?
Probably so, because one of the dilemmas is if you've been used to having profound pain relief from a narcotic, it's very difficult to replace that effect. And so it is a bit challenging. It's like a chef cooking a soup, you know. You have to add some things in, a little bit of this, a little bit of that. And then, of course, you do work with the addiction specialist. And just as an interesting aside, those patients are really challenging if they fall and break their leg, because then they need pain medicine again because they have a fractured leg and they're in the emergency room. So you have to suspend all that, treat them with the pain medications they weaned off of, and start the process over again. So it can be very challenging.
I would imagine it would be, but let's say in a case like that where you had to have a narcotic painkiller, does that mean that they'll go right back to the addiction, or do you have a little leeway to work in?
No. In fact, and this is a great question, and it could be another 30-minute session. Addiction and need for pain medicines are very different. When someone's got a genuine injury, it's very unlikely they're going to be addicted. Addiction is really a social phenomenon and kind of a behavioral issue, whereas need for medication can be legitimate. So in a case of a fracture with a patient who's been addicted, we in our practice give them the pain medicine they need to treat their condition.
All right. We have another website question. Bill from DeSoto would like to know, how can chronic pain therapy be used on a daily basis? Is it always going to involve an office visit?
Well, Bill, most of the time it will involve office visits, because one of the things that's important for us in medical practice, particularly in Texas, is we have to document your injury. And we have to make sure that as we follow them on a chronic basis, every couple of months we need to see you. The Texas Medical Board is particularly strict about this, and they want to make sure that patients are getting the medications they need, but the issue of diversion, where medications end up in the wrong place,
sure,
is very important to Texas. So Texas pain doctors are under particularly a microscope, if you will, about this. And so we do need office visits, Bill, and we can help you, but we're probably going to need to see us at least every 2 or 3 months.
But I would say the good news there is it's much cheaper to come to your office than to have to go to the hospital and do the same thing.
Oh, yes. Well, and maybe I didn't understand Bill's question. If he's talking about the fact that he's in treatment,
sure,
or he's going through some sort of detoxification, yes, it's much less expensive to see us. Most people that are in the hospital are in there because they're literally out of control. Mm-hmm. We can manage most patients' medication problems, chronic pain issues, even straightforward detoxifications as an outpatient.
Dr. Bolger, thank you so much for being with us today. We've had a great show, a lot of information. We hope that we've answered some of your questions. You can always go to the Southwest Pain Group, and they will give you the latest information possible, www.southwestpaingroup.com. Or continue to call the phone number, 1-888-572-4411. And as I said, you can also visit their website. I'm Mike Berger. Thank you for being with us. We'll see you next time.
Thanks, Mike.
Good. Thank you.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.